Hello. So, my name is Adriana. I will talk to you today about the very exciting project that we're currently working on in Croatia. It's called Establishment of the National Oncology Network and the National Oncology Database, ONCO. It's a big name for indeed a really, really big project that we're working on. It doesn't work, so. Oh, thank you. So, how did this project happen? Actually, it is very unfortunate fact that Croatia is near the bottom when it comes to European Union countries in treating cancer. So we have a high incidence, we have a really high treatment costs, and unfortunately, very high mortality rate. So a number of esteemed experts come together and come up with the conclusion that we need to do strategical project that is called National Oncology Network and the National Oncology Database with the aim to analysis of current state of the treatment process, compare those state with international but also national treatment procedures, and provide oncologists with informed data to be able to make an informed decision about the further treatment processes. Also, this platform will standardize the process of exchanging documentation and collect, process, and exchange structural data, which is really, really important. What are the... Still not working, unfortunately. One back, please. Okay, project benefits. There are a lot of project benefits from new possibilities that will arise from this project, from impact on patient level when it comes to budget, from impact on GDP level, and it will come up with new possibilities in EU initiatives. But above all this, a main focus is on patient, and the biggest project benefit is actually that will improve clinical outcomes, that will improve patient survival rate, and it will improve patients' quality of life and the quality of life of their families. Again, not. Okay, project scope. There are 3 parts of this project. First part is the Oncology Information System, or as we call it, OIS. So OIS is a central part. It's a program that will be used by oncologists. They will work daily in this program. It will be integrated with existing healthcare IT environment in Croatia, which is really, really complex. So from one side, we have existing hospital information systems, and from the other side, we have some central health parts, like, for instance, waiting lists, for instance, e-chart for patients, or health portal, and all of those parts need to be integrated. So we need to fit in existing health environment, and there are really, really a lot of integrations. The next part, big one, is data warehouse. So we are building, we are collecting, analyzing, and exchanging structural data. We are building data warehouse not only for reporting, but for further analysis, for future medical research, and of course for further improvements in oncology treatments and in oncology care. Project is set up as a consortium. We are working three big global firms are working on it. First one is IQVIA. They come up with OIS, with oncological information system. Sourcix, which is Macedonian company, they are highly skilled in integrations. And of course, Atos Evident Croatia, we have a big local presence. We have very, very broad experience in public projects, in EU-funded projects, which is also this project is EU-funded. And of course, we have a really big team for data warehouse with a lot of subject matter experts. Project schedule. As we speak now, the team is working on user acceptance tests in second pilot hospitals. We have altogether five pilot hospitals. First one is done a few weeks ago. Second one in Zadar is currently at the finish. Hopefully everything will go okay. Further on, we have 3 more pilot hospitals, which will be done by the end of this year. And from January, we are going live through all those first pilot hospitals and then through additional hospitals in Croatia, altogether 29 of them. Those are a few numbers for this project. As I mentioned, 29 hospitals in Croatia. There are a lot of more hospitals in Croatia, but 29 of them have oncology in some extent. So maybe the most important number on this slide is 107 tumor sites, because when we started this project, there were 17 plus 1 identified cancer sites, and as we started working with oncologists and doctors, we discovered that actually some of the cancer sites are umbrellas for very different tumor sites, and so we needed to go a layer deeper. We ended up with 107 tumor sites. A lot of them have completely different data. We ended up with a lot of data, and when I say a lot, I mean in thousands. We have in thousands and still counting. Next steps and major risks. Our major risk and challenge currently is to be accepted in hospitals, for oncologists to really be able to use this product, to work daily with OIS and to use data warehouse for their daily work. There are very a lot of work is on oncologists, and they have some kind of wish to be introduced in Croatia health system a new role that would be data administrator, and that would help them to make less work with administrative tasks and more on patient level. But this is maybe a story for another time. Thank you.